All right, so for the next aspect of trying to monitor for the well-being of a baby, we are looking at a Pinard stethoscope. Okay, we're looking at a Pinard stethoscope. So they call that the Pinard fetal stethoscope. So for the Pinard stethoscope, basically you are trying to monitor the baby's, heart rate or heartbeats. Okay, so you might be doing this with this type of stethoscope, which is known as a Pinard stethoscope. Okay, so intermittent auscultation is a periodic listening to the fetal heart rate, and you do this during labor using a non-electronic device. This is known as a Pinard stethoscope. So you primarily use it for low-risk pregnancies, and it's considered a safe, evidence-based alternative to using the electronic method. So the Pinard stethoscope, we said that it's a cone shape, it's a hollow instrument, usually made up of wood. It could be metal or it could be plastic. Okay, so it's placed directly on the mother's abdomen, and it helps to make the sounds from the baby's heart much more louder. Okay, so you place one end on the abdomen, okay, and you place your ear on one end. Okay, advantages: there's no batteries, there's no electronics needed. Encourages close physical contact and attentiveness. Okay, so there are so many other things you can use, but they usually still use this traditional method so that students are able to acquire the skill, so that if you find yourself in a place that the medical or the healthcare system there is not robust, you can still do your medical practice. So the cost is cheap and is widely accessible. Okay, so how is it performed? Okay, so in active phase, you keep it there for about 15 to 30 minutes. In second stage is just 5 minutes. Okay, so steps: you palpate to also determine the fetal's position before you place it. Okay, so listen to the heart. You place it over the baby's back, so it's where you palpate and see that the baby's back is. That's where you now place it. So listen for heart rate and rhythm, count beats per minute, and access for abnormalities. Limitations and consideration is it requires skills and you must have the experience. So our healthcare professional in the hospital can listen to the sound, hear the sound, but you might not listen to it. Okay, so it may be harder to dictate subtle changes. It's not ideal for high-risk pregnancies. Okay, so that's just it for this Pinard fetal stethoscope.